We are team number 10. Our title is Chasing the Scream. Now to start with, what are the basic driving forces behind the sex trafficking in Thailand? We have identified these all forces where there are social issues and corrupt government. In terms of social issues, the twist which you gave in case study was related to it, where it came around strained relations. Second thing is corrupt government. The government has been changing for past 10 years. There have been 5 different governments in past 10 years. So these are the basic issues. Then there will always be market trends where sex tourism is there. There will be education factors where dropout numbers are more. There are porous borders and there are cultural norms. So these have led to child trafficking in Thailand. Now, the social costs involved, this is always called as the silent epidemic. The social costs involved are not very much that the society realizes, but the individual costs involved in this are way too much higher than the social costs. The individual costs involve mental distress, physical trauma, prolonged rehabilitation and stigma in the society. As a society, the cost, we cannot place the cost in terms of monetary benefits, but individual costs are way too higher. Now, when we selected the target population, we selected the tribal people. The tribal people are the stateless people and the poor people. Then we selected people migrating from villages to cities. We selected adolescents after schooling, and we selected children in detention centers. When we selected tribal people, they have a crisis because they don't have identity amongst themselves. They absolutely don't have identity cards. So that makes, and they keeps on migrating from one mountain hill to another mountain hill. So they become vulnerable to that population. When we came around the population from migrating from villages to cities, these are the minimum labor wage are different in villages and different in cities. So when people migrate to cities, they feel the minimum labor wage in cities is too less to support their family. So they get into child sex trafficking because they want to earn more money. Then there are adolescents after schooling, and then there are children in detention centers. Now, according to the recent reports of UN, the Thailand most of the time violates most of the human rights violation when it comes to detention centers. Now we know that refugee population as such is a major issue, but we are not targeting as far as our program goes because we are not directing our efforts towards the border issues. Now there is choice of target population. We have just selected one of the districts, which is the northern district of Thailand, that is the Chiang Mai district. We have selected this district for a reason that there is an equal mix of tribal as well as urban mixing. It is geographically easy to access. Then there are good minorities, NGOs, and there are also universities working in it. There is also one detention center. We want to base the model of Chiang Rai city to other cities this is basically a province which will be handled. Then we have basically our model will be based on the regression analysis model because we want our all the measures to be quantifiable. When it comes to child trafficking, it will be our Y variable, and these are the variables which are related to child trafficking. One is tribal population, which we have spoken about. Second is poverty. Third is demand and supply. Demand and supply is related to the government basically which wants to change the image more than sex tourism to Thailand. Then there are detention centers, and then there is education. We know these factors are important, but these factors are not quantifiable. The border issues, the government policies, the religion and the domestic violence. There is no real data about it. So these will be our control variables which cannot be quantified. So we will be targeting all the 5 variables which are selected. So these are the factors which are addressing the strained relations given in the case study recently. There is a humongous gap between government policies and access to people. Now, preference of the tribal and rural population for firing community. There was the Prime Minister Thaksin's election in 2001, which was related to tribal welfare system, and he was elected based on that. But the government unfortunately became autocratic and it was thrown out. So basically, the people need welfare benefits for the same. Then statelessness is a source for agitation and insurgency among the tribal populations, which makes them vulnerable to all the child and sex trafficking for that reason. Now we have three-pronged approach for the same.
What we're proposing here is a three-pronged approach, and what we're looking at is approaching the sex trafficking, childhood and adolescent sex trafficking from the outside, but we are going to direct it towards the source of it. Looking at the identity crisis and how we can go about poverty alleviation, and so we're starting with TAISA by choosing a person from the community. That we're looking at 21 districts, and from each district we are going to choose and educate a person among the population, and that person will go about creating workshops about how to attain citizenship among the tribal population. So the main problem among them is the identity crisis that they're facing right now. So bringing citizenship to them through workshops, and the next one would be taking a biometric system to that so that they can be given identity cards. This is a working model that is taken from the UNHCR. They did that for the migrant population, but now we're going to do it for the tribal population. They are natives there, but they're not citizens. But we need them to be citizens. They're eligible to be citizens. So, and beyond that, what we're going to do is use these identity cards, and then we're going to link them with the village revolving fund that is already present in Thailand. To talk about microfinancing in Thailand, it's almost a second well-developed microfinancing system in the world after Vietnam. So they already have village revolving funds and Bank of Agriculture and Agricultural Corporations that is already existent in the country, but they do not reach the tribal populations because they don't have an ID card, they're not citizens of the country. So when you take the microfinancing part and integrate it with the central system, central markets, we are going to take the products of the microfinancing and then sell it to the state market itself. In that way, they don't have to look for a market in which they'll be selling the products that they're producing using the microfinances that they get. Then looking at the second one, second prong of it, we're going to target some policies, and we're going to recommend these policies to the government which is already existent. The first one will be changing the image of tourism campaigns. Basically, when you go to the internet and you Google Thailand tourism, the first thing that comes up will be sex tourism. So we personally experienced it, we personally searched it on the Google and...
Yeah, so basically I went online, tried to understand how the tourism works there, and I found this site called the sexcupid.com. So that's basically a dating site, and I signed up for it, and I actually signed up for it, made an account, and I actually even checked out a few profiles. So and there are also sites which give you cheat sheets on how to contact each of these women and what to say, so that when you do go there, you can immediately get in touch with them, and that's the story.
So what we were trying to do is we are going to change their purview of how tourism works in Thailand and promote tourism in other ways but sex tourism. And the second one we're looking at is to collaborate with the code.org. It's actually a code which talks about it's code of conduct for protection of children from sexual exploitation in travel and tourism, and that code is usually signed by the tourist agencies who are accepted to take care of their tourism agencies that will prevent sexual exploitation of children. So by signing this, they have various benefits. They advertise internationally, and they even get the membership benefits that they bring along with them. And looking at the third one, we have to promote vocational education, because we're looking at a population after 15 years, because of the education standards, 9 years of compulsory education is required, but after 15 years of age, they have nowhere to go, because beyond that, their exams are really too tough, or outside the demand for work in them is really high. So when they have to go outside and help their families, and they choose sex industry, or maybe they're coerced into sex industry just because it's easier to enter it. And so we are looking at developing vocational centers for them. And the last one would be the detention center.
1 minute.
Okay. Looking at the detention center in Chiang Mai, in which we are looking at mental health checkups, because those are the least lacking in those situations. And this is the budget we're projecting, and we're talking about human capital, and we have given incremental salaries to those people who are TAISA. And this is the timeline in which we'll be working. And the first year we establish a connection between ourselves. We establish a rapport between ourselves and the community and the TAISA, and then we further go about enacting all the workshops. What are we looking at social benefits is that once you become a citizen of Thailand, you are eligible for universal coverage scheme, which provides health for all the people in Thailand. So we're looking at scalability and sustainability, because of microfinancing is going to be highly sustainable, and scalability, if it works in Chiang Mai, it's going to work in the rest of Thailand, because they have the similar kind of rural population existent. And these are the limitations that we found. Though, because they are remote areas, we're going to take more, they need more allocation of money, manpower, and time. And the borders in corrupt government make it even more confounding. And the stigma factors require multi-level intervention. And this is the picture that we got. It's a really painful picture, and this is what is happening. And we require interventions to stop it. It goes on for a lifetime. Starts as a child and goes on for a lifetime. And couple
You've talked about tribal members who are not citizens. Is the reason they're not citizens a lack of knowledge about the availability of citizenship, or a lack of interest in being citizens?
It's two things actually. One is they live in very remote areas and they keep migrating according to the season because they're mainly farmers. So they do slash and burn method of agriculture. So they do it in one place, then they move out to a different place. So the government does not even try to keep track of that. So even the government has not tried to reach out to them. So because they haven't tried to reach out to them, they miss out on both education and health in the process. That's why they're not citizens.
Also, the acceptability when the migration takes place from the citizens itself is very less for these tribal communities. So that's an issue.
In identifying the appropriate community leaders, what factors are you considering there?
The first one we're looking at, it's necessary that she's illiterate, she or he is illiterate, and we're not looking at full years of completion of education. We're just looking at a person who's like the prime point in the community, a person to which you will go to advice for in the community, because they're all linked together. There will be a person who's elder to all of them and gives them advice about things that they can go about. We're gonna identify them, and we're gonna train them on the workshops and microfinancing information that we're gonna give them. And we're also going to educate them about the sex trafficking that's going on and how their children are being coerced. So that kind of person, this has actually worked in India, where they identify an activist and they call her Asha. They call her accredited social health worker, and she is a prime for the society, and she helps them go about the health activities every day.
And you talked about the incentives for the hospitality industry to sign on to the code.org,
Yes.
the international access and that sort of thing. Will they be built-in enforcement provisions, or how will the various motels or hotels have?
What we're looking at right now is Thailand is a hub for tourism. Thailand is a hub for tourism, be it sex tourism or any kind of tourism. They have tourism right there. So there are going to be a lot of agencies which are working in their state. So what happens is, when we are linking all of these tourism agencies to the state, and the state makes it, provides a policy which makes it necessary for these tourism agents to sign up. So they are going to take some steps to clear their name from child trafficking. And this was organized by the UNICEF. So
Just to follow up on that and make that connection for me, because I'm missing it. The sex industry, really the hub, is Bangkok by far.
Yeah.
And people do go to other places in Thailand most of the time, not for the sex industry, because there are interesting places like Chiang Mai and the beaches and things like that. So I don't quite get the impact then, if the area that you're working in is a potential recruitment area. But then how does, so the other things you're doing, but I don't quite get how that particular
what we're
piece.
looking at, the legal policies that we're looking at, is for the state level. What we're talking about Chiang Mai was for the first and the third prong. The first prong was about poverty alleviation, and we're going to do that in Chiang Mai. And the third prong we were looking at is with the detention center, and we have identified a detention shelter in Chiang Mai, and that's where we're working. As far as the policies go, we are going to go through the state legislature, because they provide the rule for the rest of the country.
So basically what we're trying to do is, the main issue is to stop the demand is going to be difficult. It's not easy to stop the demand. So what we can do is cut the supply. So first thing is, you at least block the supply by, because tribals are the ones who get trafficked the most, because they're poor and they don't have the education. So you stop that, and also add side by side, add policies which make it at least add an obstacle for the main cities to come up with these kind of hotels or malls where where sex trafficking and prostitution is occurring. So we want to
We
at
are
least
making a dent in the demand, but trying to cut off the supply.
And a little bit, so microfinance was a
Yes.
component of that. I mean, microfinance is clearly a buzz these days.
Yeah.
Has been the last 5 years, and today as well. And that's, if you then describe the people that you're trying to target, who are migratory, you know, how does microfinance work for them? What are they gonna sell to each other? What do
We
you-
found out that poverty is a driving force for putting all these children at the risk of being sold by their own parents or being sent off from the villages to work in the cities so that they can get money. Because beyond 15 years of age, be it adolescents as well, beyond 15 years of age, they are in this huge pressure from the families that they have to bring an income to the family. Because right now, they don't have income because they do slash and burn kind of agriculture, they do not get much income out of that. So what else are they looking at? They're looking at a huge business which is happening in the cities, which is basically, according to their cultural norms, it is kind of wise for a woman to suffer as well. So when the stress on the adolescents and the children increase that they have to provide an income to the family, then they choose these industries or they're easily coerced into being trafficked.
And one more thing is, there are specific districts in the Chiang Mai province which are known for their production of wood carving and silverware
Agriculture,
and fisheries and everything. So if they are able to get some kind of funding to continue that process, then the chances of, at least you're removing that one situation where the children leave the family or the parents sell the children so that they go and work, either they work as laborers or they work as prostitutes. So we cut that too. That's the idea. So you make them self-sustainable. So you give them the money without a collateral so that they can at least set up their own working businesses. That's the idea.
That's the end of the question and answer session. Thank you.